Hello to our families and community members that are taking time out of their busy days to watch our conversation regarding contact tracing. Knowing that we've been getting more positive cases in the area and the surrounding region, we wanted to take a minute to talk about our procedures for contact tracing and possibly testing. I have with me three important people that will be doing most of the talking today because they've become our resident experts on these topics. Please welcome Bristy Tracy, our district nurse, Matt Greep, our athletic director / COVID tracer / COVID testing coordinator, and Mr. Pete Modi, our high school principal, to this today. The format for us today is that I will be asking them a few important questions regarding these two topics, and then we will make sure that if there are follow-up questions from all of you after you have seen this, we will put an FAQ up on the website. So, Bristy, I'm going to start with you. What is the first step that happens when the district learns about a positive case?
Great question. So we learn about positive cases from numerous resources. Families themselves call to report they're positive. The Department of Health will inform us if they have a case that is on their radar. We've gotten calls from physicians' offices. So many different resources that bring in those positive case notifications. And once we get word of that, we begin the process of contact tracing.
So walk us through the contact tracing and how it is done specifically here. And then also talk to me a little bit about how you learned how to do it.
Yeah, absolutely. So when we get a positive case and it's identified, our main goal is to assist Saratoga County public health nurses with that contact tracing. So that involves collecting data from the positive person, and as far as identifying if there's any need to work through their school schedule to identify if there's a connection with our school. So we also have to, give them data for transportation, if they were on the bus, when they got sick, who they were around, where they went. So lots of information specifically that comes if the school is affected. All the nurses in the district over the summer proactively took the training through the Johns Hopkins contact tracer course. And it was an invaluable course that we took. It helped us so that we can help the county speed that process along, and we're quarantining everybody appropriately and safely.
So Bristy, as a follow-up to that, there are times where our family members get information from us that say no contact tracing is necessary. What are some examples that you have that is the reason why the families would receive that information?
Sure. If your child is not involved in the process, then it's because they weren't in that buffer zone of what we were looking at, AKA if your child rides the bus with a suspected person, not the entire bus is quarantined. We definitely have a buffer zone that we look at, and if your child is outside of that zone, as well as in PE class, the lunchroom, different locations in the school. So not necessarily an entire bus or an entire lunchroom is quarantined. There's a method to how they choose who is in contact.
How about, as another follow-up question to that, the 48-hour rule? When you are part of contact tracing, I believe that you follow a 48-hour rule. Can you tell our families about that?
That's correct. We use that 48-hour rule to assist in how far back we have to do contact tracing. For example, if we are reported to have a person that's positive by a test, we can go 2 days or 48 hours prior to that positive test and then begin tracing from that day on. Another example is if they were symptomatic and had a positive test, we would want to check people they were around for at least 48 hours before they got sick. You can become symptomatic 2 days after you were in contact and infected with the virus.
Thank you. I think another important topic for our families is how do we communicate all of this? Bristy, as she said, the minute that she gets the information, we go into full mode of tracing and working with the Department of Health. But how quickly do we get the communication out to our staff and to our families? And Mr. Modi, thanks for being with us today. You have definitely gone through this recently when we had to announce that there was a positive case at the high school. So since you're a principal who's been part of the positive case, please tell us how the district communicates when and what order.
Oh, I'd be happy to. The district springs into action and begins to prepare communications as soon as we learn about a positive case. As contact tracing is taking place, we start preparing a message for staff in our building. Both teachers, aides, custodians, the whole building population from a staff perspective. Individuals who themselves are directly affected by the case, or those that we're considering may have to be put into quarantine, or that there'll be follow-up during that contact tracing process. They'll always receive direct communication from either a building administrator or from one of our nurses. We will always call families and staff directly to be able to communicate as we work through that process, before they hear potentially from the health department or Saratoga County Public Health. If we have to work as we work through that process, if we have to work with the health department and contact tracing takes more time, there's possibly a delay between our communication and communication from the Department of Health, just because there's so much to the contact tracing process, and sometimes that delay happens when it comes to actually a formal notification. And in the interim, we ask families and staff to proceed if we're concerned that they might be going into quarantine, to proceed as if they're going to be on quarantine until such time we know for sure. And then when that happens, we're asking that they follow the handout that we share regarding hold it up the right way, regarding the quarantine process and the rules they have to follow. As soon as all district staff is aware and understands what any changes to our general operations, if there are any, we post a notification on the website and then start our process of emailing messages out to families. In general, families who will be contacted about quarantining will already have received personal and direct communication from the school prior to the general communication to our school community as a whole.
Christy, I have one more question for you on this part, and that has to do with the pieces that we have put into place in the abundance of caution. If we have an elementary student, as an example, who tests positive, or who was around a staff member that's positive, there are times where we place a whole class on a virtual day or a remote learning day the following 24 hours or 48 hours. Can you talk about what the quarantine process looks like if we do the whole class, or do you know if you can tell the families, how will they be notified to know if they're formally quarantined, or just we've put them out to remote learn the abundance of caution?
Yeah, sure. So again, we get some directives from Saratoga County based on that. But as Mr. Modi stated, it does take an extensive amount of time to really narrow it down and identify specific students that are actually quarantined. There's so many different aspects we look at based on the classroom, based on the proximity of the desk. I think we've done a lovely job with our mask wearing and our spacing in the classrooms, and that's super important to try to decrease that number of students that are quarantined and affected. So for examples of past cases, we've quickly identified who they are suspected, where they've been sent home, done their virtual learning while we complete our investigation, of course, and then we try as a district to make that personal notification once we get confirmation from the county that this so-and-so student is officially quarantined. I think that's the best mode to handle that with. So they get told by our district administration first that they are going to be quarantined for the allotted amount of days that are dictated, followed up with then a call from the county, so they're not really overly alerted and nervous about that call.
And I think that one of the pieces from my end that I'm so appreciative of is our teachers worked hard on creating pivot plans. And working through those pivot plans and sharing those, hopefully, with their families when they need to. And so I know teachers are prepared on a moment's notice. If they have to go to remote learning, they can do that. Other questions that we get in this area are around cleaning and cleaning of schools. And what is our cleaning procedures, not only each day, but when a case happens, we close down to re-clean the school. So as I said, Mr. Greep volunteered so nicely to help us with COVID tracking and testing. And so I know he's very up on our cleaning procedures for each building in the district. So can you please, Mr. Greep, talk about what we're doing right now, currently cleaning on a daily basis, but then also what we do with a positive case?
Yeah, so on a daily basis, our custodial staff works very hard every day to ensure that all our spaces are clean. We've actually picked up additional temporary cleaners in each building to help out and maintain and clean and disinfect high touch areas. Rooms are disinfected regularly. Our custodial staff has been trained and informed on certain protocols for cleaning. Confident that we're getting the cleaning done and there's no disruptions. They use multiple sources, multiple solutions, cleaning solutions and solvents to disinfect. They generally rotate between 3 or 4 different solvents when they are disinfecting those high touch areas, in addition to our fogger, our ionizer, which will help get into some of our more porous areas, such as elementary school rugs, auditorium seating. So our cleaning is, I believe, above and beyond what we should be, what is required from the state.
Did we have to hire any additional staff to get this done during the days that we have available to us?
We actually added a few temporary cleaners to each building. I know here at the high school, I've seen Carrie Duell volunteer her time and going through the hallways, disinfecting some of the classrooms and some of the high touch areas. So we have employed additional people to help accommodate our needs and satisfy our needs when it comes to cleaning all the buildings.
Thank you. Christy, you did mention transportation when you were talking about contact tracing, and I want to get into transportation just a little bit more because we do have so many families that need that ride on the bus. Can you please be a little more specific on how that contact tracing is done on a bus?
Sure. So thankfully, our bus personnel are great with providing us with a seating chart. All students are assigned to their own seats. And that makes it very easy for us to identify where they were sitting in reference to the positive person. Daily attendance is taken as well, so that, if your child happened to not be on the bus that day or that week during the time period that we are tracing, then we can quickly remove them from the list and know that confidently we've gotten everybody that was on and off the bus. Our busing still requires masks to be worn. They are spaced out generously so that children are still maintaining that distance on the buses as well.
Thank you. One last question on contact tracing, and I'll shoot this one to you, Mr. Modi. I know there's always that concern of why can't we really tell people who are positive? Why can't we provide more specifics? Because people want to do the right thing, but they feel like they need that important information. Can you talk to us about why, this part is the hardest part of all for us?
Oh, absolutely. And first and foremost, I certainly understand, especially when you're dealing with anything that's medical, the need for information to try and make sure everything and everyone is safe is a real thing. But the district is bound by certain privacy laws at the state and federal level that require us to only share the level of information that we share. And I can understand the drive to want to know as much information as you possibly can. I just ask that all of our families trust the process, know that we're sharing what we are legally allowed to share, and that we are doing our absolute best to keep the information spread to an appropriate amount based on a student or a staff member's potential exposure, and just keep to that. So I just ask that you trust that we're doing our absolute best to keep everybody in our building safe. And I think, to the best of our ability, keep our buildings open throughout that process.
Thank you. Thanks for that important information on contact tracing. To our families that are out there, we're going to switch to testing a little bit now. But hopefully you can see that our staff members take this very seriously, and we're thinking about every single thing to keep our students and our staff safe on a daily basis. I think one thing that's been happening across the state, and I'm sure that you've heard, is that the governor has now started tracking what's called microclusters. Microclusters can be yellow, orange, or red in our area, and there's different percentages based on the area as to when they turn into a microcluster. Schools around the state have already been put in yellow, orange, and red microclusters, and they've already begun testing students in order to stay open. What they found in their data was that schools' rate of infection is significantly lower, if there is any at all, comparatively to the percentages of the county or the region that they're in. And so based on that data, the governor has now stated that schools can stay open in yellow, orange, or red as long as certain testing occurs. So in order to get ahead of this, in order to make sure that we're keeping schools safe and keeping schools open, we have created some testing plans. So my next questions are going to Matt, because again, as he volunteered to be the testing coordinator, one thing that I'm happy with is that all 6 schools will have a very similar experience when we have to test that first 20%. Again, to our families that are watching, this is completely voluntary. In no way are we asking every student to test if they don't feel comfortable, a family doesn't feel comfortable on that. So Mr. Green, I'll turn it over to you and you can walk us through our plan, please.
Yep. So upon entering yellow, depending on the building, well, on every building, 20% of that total population, so that includes faculty, staff, and students, need to be tested. And they will be tested at a random selection based off of our parent and faculty consent forms that people had signed up for. Prior to our testing, parents of the children being tested will be notified. Again, from that consent list, it's going to be a random selection. But again, everybody, even though that consent is there, we want to verify that consent. We want to ensure that that it was not a mistake and that everybody is in the know and there's transparency through this entire process. With that, I've been working with building principals. Every building has submitted their plans for the testing logistics. A couple of big focuses is trying to maintain that social distancing, identifying our kids. There's going to be a check-in station where identities are confirmed, and they will then be escorted to a testing desk an RN who will explain the testing procedure to the students. That sample is collected and will be taken to another station where we will await for those results. We've really worked hard to try and limit the flow to one direction, so there's no exchanging or bypassing of individuals. At that point in time, upon students completing the test, they will be going back to their classrooms. We are presuming that everyone is negative at this point in time. If a staff member or student does test positive, we will begin, Bristi and Flora Covey will begin containment and contact tracing immediately. If your child tests positive, you will be notified within the hour of taking the test. With that, we will follow all county DOH contact tracing protocols, like Bristi has discussed previously. With that, the district will continue to communicate daily on how many people were tested, where the testing took place, what the results were, and that will be reported out to the state as protocol.
Thank you, Matt. There will be more to come on this if their need arises for us to test. I do want to thank Pete, Matt, and Bristi again on this. I know this recording is a little longer than I normally send families, but I wanted to make sure we covered everything. You will be getting additional videos of what testing looks like if it comes to one of our schools. So you will be able to see firsthand what students will do when they test, and we'll make sure we get that out to you. This is all a process that's new to everyone, so please bear with us, and we're happy to take any questions that you have along the way. Stay safe, stay with your family. Please make sure to mask up both in school and around the community. Thanks.